Hello and thanks for joining us on this episode of Health Options. I am Rabi Abdullah. A year has rolled by since Nigeria recorded its first case of COVID-19. Since then, the situation has evolved with the federal government and states keeping up measures to combat the virus. Despite control efforts at the pandemic, there are still very critical challenges such as the second wave and the emergence of virulent variants of the coronavirus. Others include the rising number of deaths and the increasing need for oxygen, skepticism and denial, to mention just a few. That's our focus on this week's episode of Health Options as the country enters the phase of the non-pharmaceutical interventions plus vaccines stage of the national response. Thanks for joining us on the program. This is Health Options, and we are evaluating the one-year milestone of COVID-19 in the country. And to take us through that is the Presidential Task Force on COVID-19 Incident Manager, Dr. Mukhtar Mohammed. Welcome to Health Options, Dr. Mukhtar.
Thank you for having me. Thank you.
All right. Just like yesterday, February 2020, was a year ago, and a whole lot of things had happened. What can you tell us when it comes to the high and the low moments for us as a people?
Well, thank you very much. First of all, I would say that it has been a learning curve for most of us. It is something that we have not experienced in the past in the country. We went through this global pandemic with a lot of energy and a lot of expectations. And I'm glad that we are able to come through to this time, that we have learned a few things during this experience. Top among it for us at the coordination level at the PTF is that we have realized the power of working together, having different aspects of government, to come together in a multi-sectoral, multidisciplinary approach, to strategically focus on a health problem. That has helped us a lot, and we have learned a lot of lessons.
Okay.
Second, in the area of resource mobilization, we know that not only government can provide all the funding that is required because it is enormous. So we have also learned that working with the private sector, working with the donor communities, will be able to leverage on resources to be able to utilize this response. Third is the expertise within the country. Nigeria is so blessed with so much human resources, people who are willing, to mobilize themselves and to go to any length to make sure that they provide their own support and they contribute their own quota in terms of epidemic control and treatment. So we've seen all of that, and we have learned that really working together will be able not only to fight COVID-19, but any future pandemic that we are going to face.
The second wave, is one that had come, with a whole lot of, so many things, a paradigm shift. We're talking about the increase in deaths, even in cases. And I was at one of the isolation centers in Abuja just last week, and some of the complaints that I gathered from there had to do with the fact that even though personnel who work within those isolation and treatment centers, do so voluntarily, but right now, that isolation center, and I'll be specific now, I'm referring to that of the Abuja University Teaching Hospital located in Gwagwala, which is currently, grappling with the challenge of shortage of staff. And another thing that, came as a surprise to me, is the fact that the kind of, private sector involvement that we saw in the first wave, from what I was told, is really, really gone down. What happened? What can you say?
The issue of human capacity at the isolation facility. It is located within the teaching hospital, And we have staff who have been properly trained, and these staff have been distributed to cover the 3 shifts that they run. You have medical doctors, you have nurses, you have other healthcare workers that are supporting it. The hospital is fully cooperating and are working with the Ministry of Health. We have the case management pillar at the Ministry of Health, who not only supervises the isolation facility in Gwagwalada, but also provides guidance to all isolation facilities in the country. So if there are issues of staff, our expectation is that this should be handled and addressed quickly. Patients should not be allowed to suffer or to feel the impact of lack of staff, because there are enough people who have been mobilized. We have intensivists, that is intensive care providers, who have also been trained to provide that services. So if there is any gap, I believe that between the hospital and the Federal Ministry of Health, that should be resolved. And the pity of this has not escalated to us. Regarding the donor issue, yes, at the beginning I must sincerely appreciate the private sector facility because they all came together. Talking about the organized private sector, our banks, specific philanthropists and the central bank came together under the umbrella of COVID. And they came out, they raised, I don't remember the amount now, but they said, how do you want us to spend this money? So we worked together with them to determine the needs. At that time, our need was to establish more isolation facilities. And they went ahead to establish these isolation facilities, some of them in tertiary hospitals and some of them open spaces, because at that time the prediction was that we are going to be handling thousands of cases on the street. But luckily that did not happen. Even right now, it is not that the support has dwindled. It is that they are providing the support in another way. We have a lot of activities going on regarding screening of people who are coming into the country from the airports, and the private sector is actually contributing a lot in that regard. They are supporting our IT system, that is the portal that is handling the Nigerian International Travel Portal, where people register and upload their test results before they come into the country. They are responsible for providing internet in all of the airports. So I won't say that the support is dwindling. I would say that it is just being redirected into other focus.
Okay, so you wouldn't say it has anything to do with the way and manner whatever came in the past was managed? Because we're talking about commodities now.
When the private sector raised their funds, they did not take these funds and deposited it into an account with PTF. No, they managed these resources themselves. So it is their account, it is their money. They decide on what to buy, when to buy, and how to distribute it. What we do is we work with them to make sure that there is equity in the distribution and also there is quality in what we procure and how we distribute it. So we provide them with the advice. And right now what we are discussing with them is to try to get an inventory from them of what they have procured and where they have distributed them. Most of these things have been donated to the state governments, and we are working with them. They are going to provide us with the end users, the list of the end users, which facilities are these commodities are located. So it has had nothing to do with transparency or how funds were spent.
Okay, good to know that. Let's look at the issue of some other issues, playing out. We still have a lot of people who live in denial. They still don't believe that there is COVID-19, and even for those who believe, they just feel that figures are being inflated for ulterior motive. So and that brings us to the issue of the rising cases as it is. What are we doing differently, or what do we intend doing differently, apart from the enforcement order from the president?
So unfortunately, COVID-19, like many other viral diseases, it does not have a cure. Unless you have a cure, that is when you say, okay, people come and take treatment. What you do, the best that you can do to yourself is to prevent yourself from getting infected, protect your family, and also protect your community. So these interventions will continue to be with us for a very long time. Now, the issue of enforcement, that is where government comes in, to ensure that, the freedom of one person does not constitute an infringement on the right of others. If somebody is ill, is sneezing, is having fever, and he comes into public places, it's likely that he is going to distribute that disease to a lot of people, even though that is not his intention. So that is where the enforcement of government comes in. The enforcement is not meant to restrict people. It is not meant to be punitive, but it is just intended to protect other people so that they don't get infected. How did we arrive at the second wave? There was a lot of complacency from the authorities, from the individuals, from communities. People feel like because we have eased up, we have opened up the society, there was no longer lockdown, so people felt like COVID has gone. We continued to interact, we continued to have ceremonies and celebrations. We started sporting activities. By the time it was December, there was a lot of parties and celebrations. We had the NSAS protest, we have a lot of other, and it was the effect of all this non-compliance that culminated into the second wave. So it is important that we continue to abide by these regulations because there is no treatment. The only way we will do it is to protect ourselves.
Okay, looking at the enforcement order now, it seems to be more effective only within the civil service circle. Do you agree with that?
Well,
and corporate organizations. Outside that, people just go about,
So within the civil service, that is within the control of government, and that is where we feel that we should set an example for others to follow. The private sector, I believe, is also trying because we see how they are trying to control people, institute temperature checks, and also ensure that people without mask are not allowed into the premises. But again, it has to be a continuous process. I agree with you, it's only a few urban centers that you see this enforcement in place. But we are working with all the state governments. We had a meeting where we agreed that we have to support the other states to be able to enforce compliance in different places. It's not going to be easy. It has to be a continuous effort, and it has to be owned by the states and sustained by them because the federal government cannot be everywhere. What is needed is to provide the enabling environment or the enabling framework, which Mr. President has done by signing the health protection regulation.
Okay, let's look at the big one, the most current, talking about vaccine now. Nigeria had, finally taken delivery of its first consignment of COVID-19 vaccine, talking about the Oxford AstraZeneca vaccine, and almost 4 million. Yeah, and it's different for different folks, if you ask me, because some people are excited, others are just indifferent, and others are still, on the fence, hesitancy, thinking of whether to go for it or take the jab or not. What have you got to say?
We are actually delighted when we received the delivery of the 4 million doses of AstraZeneca vaccine in the country. It is something that we have long expected. A lot of work has gone, a lot of negotiations and planning have gone into place. So certainly we have people who are really expectant to receive it. And I want to believe that that will constitute the majority of the informed people. We have people, like you mentioned, who may be sitting in the fence. We have to, we hope to convince them. We hope that they will be able to reason with facts and with science. And of course, we have people who are living in denial. Now, that is where a lot of effort has to be put in place. We are engaging with the traditional rulers in the country. We're engaging with the religious leaders. We're engaging with the media, to try to advance this cause. There is nothing like COVID-19 vaccine is meant to hurt Africans, or it is meant to put a chip in somebody's body. All this false information, they have to be discontinued.
Conspiracy theory.
There are a lot of conspiracy theories, and these are not limited to Nigeria. And in the days of internet, people can go and read anything, and the fake news proliferates more, I think, than even the fact or the real science behind it. So we have to work on that, and we continue to work on it, and we have different strategies to try to approach the various communities in the country with the correct information.
In the efforts to ensure efficacy or potency of the vaccines, at what level or how long can it be left outside that could render it, impotent or ineffective?
So the good thing with the Oxford AstraZeneca, and it's really in our choice, because it will fit in more with our existing logistics system. It can be stored at 2 to 8 degrees centigrade. That is, our ordinary freezers, home freezers, which you have available in most of the healthcare facilities, and also in our strategic stores in the country. And it can be brought out of that and then, preserved with ice pack, inside a cooler, transported and then utilized. When you have not finished all the vaccine, you can still return it to the refrigerator. So it is really workable, and it can tolerate even some few days, without actually being refrigerated. So it is something that, we believe that our current system can sustain, and we do not have fear of wastages. We do not have fear of lack of electricity, because the NPHCDA has assured us that we have these solar-powered freezers, that are distributed in the country, and there are a whole lot of them.
Okay. So talking about, aftermath of administration now, of course, there could be adverse effects, there could be the normal, reaction because something new had gone into your system. And what mechanism do you have, like in tracking, records of those who had taken the jab? How's it gonna be?
Yes, so that is really one aspect that I think this vaccination system is well prepared for. If you look at it, the registration is very didactic. We have to record your name, your phone number, the point where you are going to get your jab, and then you will report if you have any adverse reactions. Now let me come to that. Like you rightly mentioned, whenever you have vaccine, any vaccine, there are bound to be some side effects or reactions which are considered to be normal. For example, at the injection site, it's likely, of course, you will have pain because you are being injected. Second, there might be some small rash at that place, at the site of the injection. That is also normal, but most importantly, whenever you inject something that contains protein into the body, it's bound to elicit, a rise in temperature. So that whenever people get that kind of feeling, symptoms or signs, they should report. We have a tracking system that the NPHCDA has rolled out for people to report any adverse effects that they have noted. Now, there are known adverse effects for this vaccine, which will be symptoms similar to the disease itself. Now, that is where people may get confused, because it's likely you can have high temperature, you can also have some signs of cold, like running nose or sneezing, and others, because it is eliciting reaction, within the body. So some people will think, oh, I'm coming down with COVID. Yes, you have been vaccinated against COVID, and you are just coming out with some of the signs, because the symptoms of COVID themselves are as a result of our body trying to fight the virus. That is why we have running nose. That is why we have fever. That is why sometimes we have cough, because our immune system is trying to fight it back.
How does the vaccine play out?
Okay, so let me start. If you have not contracted the virus and you are eligible, you'll get vaccinated. And if you are vaccinated, it means you are getting protection against COVID-19. Now, how is this protection? The virus itself, this Oxford AstraZeneca itself, is what we call a viral vector vaccine, meaning that it is a virus that is gotten from other animals, chimpanzees in this case, and now deactivated, and now the part of the virus is now injected into you so that it elicits the production of some part of the virus, so that whenever you come into contact with the virus now, your body already knows how to fight the virus. So your body reacts and fights. It prevents you from actually getting the disease. Okay, you can get infected, but you will not come down with the disease because your body knows how to fight it. Now that is somebody who has not been infected. In somebody who has been infected, already the body has been sensitized and it has produced what is called the humoral antibody, which is mostly, the antibodies that are there. But these antibodies don't last long. We don't know. Up to now, we don't know exactly how long they last. Some studies have suggested that they can be there for 3 months. Some have said for 6 months. But we have recorded cases of infections where people were infected with COVID-19 and 3 months after, they now come down with the infection again. So that has not been established, exactly. It will take time for us to do that. Now, what the vaccine does in this kind of people is to help you produce the long-term immunity, which is those cells that will now recognize the virus or any part of the virus and they will fight it. So again, it means you can get infected, but you will not come down with the disease. In somebody who is already infected, currently he has tested and he is COVID-19 positive. Our advice is that person should wait, should not take the vaccine at this moment, because his body is already producing the antibody. He's already reacting to it. So we would wait until after 3 months when he is negative, then he can now take, because by that time the antibodies would have declined to a level where he will now become exposed. So everybody among these three groups, we all need the vaccination, because even if you have been infected, it is not for lifetime. It is just for a short period, say 3 months, they say 6 months, but our advice is after 3 months, if you test negative, then you are now free to take the vaccine so that you can have the protection for a longer period.
Okay, so how long does it even confer immunity on someone?
With COVID, we will not rush to say that it will provide you lifetime, because scientists are still studying the facts. So we know that at least it will give you protection for a much longer time.
Okay. Yeah. Your final word to Nigerians, now that we're in the state, of vaccine administration.
Yes, the most important thing right now is for people to try to get access to the vaccines, to try to register. There are many diverse routes through which people can register for this vaccination, and for people to also try to not to follow any fake news or all the conspiracy theories, to understand that these vaccines are working. We have seen it established, with facts. We have seen countries where a large number, if you take in the UK for example, a large number of people who were in the elderly home, were coming down with the virus. 80% of them, come down with the disease. When they have been immunized now, the cases have declined, been eliminated. Zero. No cases are coming. So certainly that is to say that the vaccine works. We have evidence that it works, and we urge Nigerians, to be able to comply and also register for this vaccine.
Okay, I was made to understand that if one's immunity is slow, the vaccine might just not have any effect on you.
Yes, absolutely. Yeah, that is true, and that is still being studied. So people with immune deficiencies, long-term immune disorders, they have to be evaluated on case-by-case basis. If the immunity is actually very down, it means that the body will not be able to mount the required immunity to fight the disease. Okay. So your physician will have to evaluate and then advise accordingly. Okay.
Thank you so much, Dr. Mukhtar Mohammed, for coming on Health Options. We really appreciate your time with us.
Thank you. It is my pleasure.
our package for this week. A quick reminder that you can go to our YouTube channel to watch the upload of these and other episodes of the program. Email us for your comments and contributions at healthoptions@nta.gov.ng. My name is Rabi Abdullah, and I urge you to stay safe. Bye for now.